How many intrauterine inseminations, or IUIs, should you do before moving on to IVF? This is such a common question for my patients, and almost everyone says 3 to 4 IUIs before IVF. But that might be the right number for you, but maybe not. It's nuanced, and I'm going to answer this question and review the research today. I'm Dr. Lora Shahine. I'm a double board certified OBGYN and reproductive endocrinologist helping people with IUIs and IVF for over 20 years. I love educating. If this is the first time you're finding my channel, welcome. Be sure and subscribe so you get my weekly videos all about reproductive health. There's 2 other ways to stay in touch. There is a link in the description below to my newsletter. You can get weekly updates on fertility topics and recommendations. And the second way is my weekly Brave and Curious podcast. You can listen anywhere you listen to podcasts and see the playlist here on YouTube for the video interviews. Now, today we're answering a very important clinical question that I talk to my patients about every single day. How many intrauterine inseminations before you consider moving on to IVF? We're going to go over 5 main topics. Number 1, we're going to do a refresher. What is IUI? What is IVF? I don't expect you to remember everything. There are so many acronyms in this field. I'm going to make sure you know what we're talking about. Topic number 2, where did this general recommendation of 3 to 4 IUIs come from? We're going to go over the study and the reasons why this is a common recommendation. Topic number 3, I'm going to tell you when we should alter that recommendation, how sometimes people should never do any IUIs, or people might do more than 3 or 4 IUIs before considering IVF. Topic number 4, I'm going to give you some real-world examples on how I counsel patients to help you understand a little of the nuance. And finally, stick around to the end. Topic number 5, I'm going to leave you with 3 important questions to ask your doctor so you can figure out the right next steps for you. Topic number 1, refresher, IUI versus IVF. 2 fertility treatments, both assisted reproduction, but very, very different. IUI stands for intrauterine insemination. It is a low-tech fertility treatment in which sperm, which has been washed and prepped, is placed past the cervix into the uterine cavity around the time of ovulation. It is often done in conjunction with controlled ovarian hyperstimulation, meaning pills like Clomid or Letrozole, maybe some injection medications, often timed with a trigger or ultrasounds. But the real process is low tech in that you're just placing sperm into the uterine cavity around the time of ovulation. And after that, everything else is kind of left up to, is it a perfect egg? Is it a perfect sperm? Do the egg and sperm even find each other in the fallopian tube? And how about that implantation piece? So intrauterine insemination is low tech, working with your cycles, less invasive, and quite honestly, usually less successful for many people compared to IVF. IVF stands for in vitro fertilization. And this is assisted reproduction, totally different than IUI. It is the process of stimulating the ovaries to recruit more than one egg around the time of ovulation. But before you ovulate, getting the eggs out of the body with a procedure called an egg retrieval. Those eggs are then looked at under the microscope in the lab and fertilized with sperm. This is where the name comes from, in vitro, in the lab fertilization, as opposed to in vivo or in the body fertilization. After the eggs and sperm are fertilized, embryos are watched and looked very closely for their development. Sometimes you can do a biopsy on the embryos to test for genetic conditions. Sometimes people don't do that, but sometimes you do a fresh embryo transfer. Sometimes you freeze all the embryos and do a frozen embryo transfer later. But the basics is very different from IUI in that it is more invasive, more complicated than IUI, more expensive for sure. Sometimes people have coverage, sometimes people don't. But it typically has a higher chance of success because you're controlling for more variables. You're making sure the eggs and sperm fertilize, you're watching embryos develop, you're selecting the best embryo to transfer, and the success rate is typically higher. So there is your basic refresher in IUI versus IVF, a very traditional path for patients who are going through fertility treatment. Depending on indication, if both options are open to the patient, very often people will start with intrauterine inseminations first because it is easier to get started, less expensive, less invasive. And only if the intrauterine inseminations do not work will they move on to IVF, which has a higher chance of success. And a really common question is, how many IUIs should you do before you move on to IVF? And the number that is all over the internet, Reddit, Instagram, you probably heard it from your doctor, is 3 or 4 intrauterine inseminations before IVF. So topic number 2, where does that common recommendation of 3 or 4 IUIs before IVF come from? It comes from a famous study published in Fertility and Sterility Journal 2008 from a study that was done out of Boston IVF. Lead author is Serena Dovey, and let me tell you more about the specifics of the trial. The objective of the trial was to evaluate outcomes of a large cohort of patients undergoing fertility treatment with clomiphene or Clomid and intrauterine insemination. It was a retrospective cohort study done in a large practice, Boston IVF, and a total of 4,199 intrauterine insemination cycles were done in 1,738 patients between September 2002 and July 2007. The main outcomes measured were cumulative and per cycle pregnancy rates for patients based on age and number of IUIs completed. So basic conclusions are, as anticipated, younger patients had a higher chance of conceiving with intrauterine inseminations, and they had a higher chance of conceiving with fewer cycles of intrauterine inseminations. So one outcome and one result published from the study that led to this universal recommendation of 3 to 4 IUIs before going to IVF is table number 2 within the study, and it was looking at the overall success rate of conceiving within 3 to 4 intrauterine inseminations, and it was broken down by patient age. You can tell from this chart that the vast majority of patients, if they were going to conceive with an intrauterine insemination, it would happen within 3 to 4 cycles. For example, in the patients that were under 35 that were doing intrauterine inseminations, 89.5% of them conceived within the first 3 cycles, and 94.5% of them conceived within 4 IUIs. So if you're under age 35 and you're doing IUIs, the way to think about it is, if you don't conceive within 3 to 4 IUIs, it doesn't make a lot of sense to continue doing more IUIs. Of course, there are patients who will conceive on their 6th intrauterine insemination or their 10th IUI, but chances are, if an IUI is going to work for you, it's going to happen within the first 3 or 4 tries. So it makes sense to give it a try, but if it doesn't work within 3 or 4 tries, move on to IVF. Topic number 3. Well, okay, we've got the recommendation, but is that for every patient? Is that a universal recommendation for all fertility patients? Absolutely not. So there are reasons that IUI is not available to patients. So if someone has blocked fallopian tubes, or they're missing fallopian tubes, they were removed for some reason, there is no place in the body for the egg and sperm to find each other. So for that patient, an intrauterine insemination is not an option. And IVF is an excellent option because you can get the eggs out of the body and get sperm out of the body, and you can fertilize eggs and sperm in the lab, in vitro fertilization, instead of in the tube. Another reason why intrauterine inseminations are not available to people is significant male factor infertility. So you do need a reasonable amount of sperm to get pregnant with an intrauterine insemination. Typically, you want to have a minimum of 5 to 10 million moving sperm in the sample that you use to inseminate for an IUI. And you do lose some sperm when you process it. You lose a little bit of sperm if it's been frozen before. But if you're looking at the final number, you'd love to have a minimum of 5 to 10 million moving sperm in that sample. And there's some times where people have very little sperm. It can be less than 1 million sperm, just even in the semen analysis. And after you wash it, or if you're processing it, that is just not enough sperm to have success with an IUI. There are reasons that IUI is just not possible for some patients, and those are 2 great examples. There can be other reasons that people would bypass intrauterine inseminations and go straight to IVF. One example is family planning. So someone's starting their family close to 40 and they really want to have 2 or 3 children. They might conceive with their very first IUI, and that is awesome and so exciting. But then you're pregnant for a year and you're not able to try until the baby's a year old, and then you're trying for baby number 2 when you're 42 or 43, and that can be very different fertility challenges. Age and fertility is a really important thing to understand. And when you're thinking about your options, you should really talk to your doctor about your overall family goal, because it might tailor the next steps and what options are best for you. There are reasons to do more than 3 or 4 intrauterine inseminations. There are patients that will not ever do IVF, ethical reasons, other reasons. And so you're not really worried about making that decision between how many IUIs before I go to IVF. If IVF is off the table, then you might want to do more intrauterine inseminations because it is typically a higher chance of success than trying without assistance. Another reason is if someone is doing these inseminations because they're using donor sperm to conceive, single parent, same-sex couples, a partner with azoospermia, any reason that you have normal testing, there's no other fertility indications, and you're really just trying to get sperm exposure, then you might want to do more than 3 or 4 intrauterine inseminations, maybe 6, maybe 10, kind of really talking to your doctor about what's right for you. But I want you to realize that this 3 to 4 inseminations is based on general population, and it might not be the personal best choice for you. Topic number 4, how would I counsel certain patients? Because I kind of talked in general how some people could do more, some people could do less, but I do think giving you patient examples can be really helpful. Patient number 1, 34 years old, regular menstrual cycles, unexplained infertility for over a year. That means all the testing has been done with both partners and there's no obvious reason they are not conceiving. And they really want to have 2 children. So for this couple, I would talk to them about both options, but I would say it's really reasonable for you to do 3 or 4 intrauterine inseminations. And if you conceive, that is fantastic. You are coming back to try again when you're maybe 36, 37, and that's still a really good window to hopefully have the family of your dreams. But if it's really unexplained infertility and they are not successful, they should conceive within 3 or 4 tries. It makes a lot of sense to move on to IVF at that time. Patient number 2, 40-year-old female patient, reassuring testing, reassuring menstrual cycle history, unexplained infertility, trying for 6 months, and really wants to have 2 children. Now, this patient, both options are open to this patient and this couple as well. Start with IUIs, go straight to IVF. But I would counsel this patient that really strategically, if you really want to have 2 children, if we do conceive with our very first or our 4th intrauterine insemination, fantastic, wonderful, but that person's fertility is going to be dramatically different when they're trying for baby number 2, and they might want to consider doing IVF sooner, maybe before they even try IUIs, or maybe they do 1 or 2 IUIs, and if that isn't successful, move to IVF. So it's personalized, but you got to take the whole picture into account. Patient number 3, 33 years old, never tried to conceive, reassuring history and testing, using donor sperm to try to conceive, and wants to have 2 children. So this person might do more than 3 or 4 intrauterine inseminations. The only reason they're doing IUIs is to have the sperm exposure because they're trying to conceive with donor sperm. There's no fertility red flags or reasons that IUIs shouldn't work. And it's a dramatic step to go to IVF as far as cost and invasiveness. And so that person might even do 6 or more donor sperm intrauterine inseminations before moving to IVF. Very personalized. Finally, patient number 4, 31 years old, PCOS diagnosis, that's polycystic ovarian syndrome, very irregular ovulations, ovulatory dysfunction, and mild male factor. So a lowish count, but not dramatically low. So both IUI and IVF are options, and wants to have 1 child. So this couple might really do more than 3 or 4 intrauterine inseminations. They have really strong indications to help with ovulation and help get sperm exposure right around the time of ovulation and mild male factor, just washing and prepping and getting the best sperm closer to where it needs to be in the uterine cavity, and they really only want one child, they might do a lot more intrauterine inseminations before going to IVF because we're thinking about their goal, we're thinking about age, and we're thinking about indications for IUIs. So these are 4 very different examples, and honestly, in each scenario, both options are open, and someone could say, appreciate the discussion, but I know IVF is a higher success. I want to go straight to my goal. Or appreciate that the data says that, gosh, I've done 4 intrauterine inseminations. I really should move on to IVF at this point, but I'm going to do a few more intrauterine inseminations. So really important to personalize and think about why you're doing the fertility treatment, your family goals, and what is right for you. So topic number 5, I'm going to leave you with 3 questions to ask your doctor if you are thinking about this important clinical question. Number 1, what are my chances of success with intrauterine insemination? Thinking about my diagnosis and my personal situation. Question number 2, at what point do you think I should consider moving to IVF? How many intrauterine inseminations should we consider doing before we think about making that next step? And question number 3, when I'm ready to make a decision, either direction, how do we get started? How do I get my questions answered? And where do we go from here? Success in fertility treatment is not just about numbers. It is a full picture of thinking about you and your personal situation. If this video helped you, give it a like, comment with questions that you have, and be sure and subscribe to this channel so you get my weekly videos. Don't forget about the newsletter. Don't forget about the podcast. You can go to my website, drlorashahine.com, for lots of learning. And until next week, stay brave and curious.